A month ago, Mohammed Adam gathered what medicine he could when he heard the Janjaweed, an armed group known for killing civilians, was about to storm his hometown of Tendelti in West Darfur. He says he loaded the medicine on a horse-drawn cart and rode the kilometre or so across the border to neighbouring Chad. Since then, he has set up a makeshift pharmacy in Koufrone, a refugee site where about 10,000 people live.
Mostly now we need help with items for children because they are getting sick with infections, diarrhea, coughing, and especially there are problems with measles. It's mostly children who are our patients.
He says he pays for the medicine his patients receive himself. Medina Ahmed Ishak has just arrived at the pharmacy seeking treatment for her baby, Abdul Razak.
My child is sick with malaria and has diarrhea. Any food we had to eat is gone, so now I don't have enough. I pray that my son becomes a doctor one day.
Since Sudan's conflict began on April 15th, Chad and aid groups have struggled to provide enough food for refugees to eat. Medical aid is scarce too, according to refugees. Inside Sudan, the healthcare system has all but collapsed. This video purports to show a hospital in Khartoum gutted by the fighting. Others in the city are said to have been severely damaged, along with hospitals in West Darfur where much fighting has taken place. The medical non-profit Doctors Without Borders said Tuesday that its medical facilities had been looted, while a staff member had already been killed in April in the fighting. It says the looting will have life-ending consequences for the Sudanese people. Amir El-Tom is the Assistant Secretary General of the Sudanese American Physicians Association. He says with the Sudanese government not functioning because of the fighting, his organisation is helping fund the running of some hospitals. A week-long ceasefire that began Monday should allow some medical aid to enter the country.
Some of the hospitals that have been shut down for various reasons are the largest in Sudan. Some of the tertiary hospitals that other states referred to. Basically, the fighting has to stop. Otherwise, one catastrophe after the other in different or various fields of medicine will ensue.
Adam says refugees need more help from the international community, however.
First, I ask all nonprofits and local communities to help the refugees because they really need it. They have no place to protect them from rain, which helps spread diseases. We are concerned about the spread of cholera, which could turn into an epidemic. It will be a catastrophe.
He says he's doing what he can with what little he has. Wilkins for VOA News, Koufrone, Chad.